Joining me on the program now, a researcher from the Maxim Institute, Debora Spiekermann. Kia ora, thanks for your time today.
Good morning, Andrew.
Is it the case that that AI has already arrived, that there is an aspect of AI within medical treatment at the moment?
Yes, that's right. There are already some implications of AI in the medical field. Some of them are more minor. Some of them could have actually quite a big influence on the clinical decision making. And in general, we differentiate between AI that is used along the patient, so that are systems that support doctors in making decisions by analyzing AI data. And then there is sort of the other spectrum, which is more on the administrative and research side, which doesn't might not affect the patient directly, but is kind of working in the back to improve medical care.
And honestly, it means that the AI can do all the boring stuff, so the doctors can work on their bedside manner, which isn't necessarily a bad thing. I suppose back in the day, if a doctor has to pull a book off the library shelf to look something up when they're making decisions about our treatment, not really that different for them to grab their phone to check some details on some stuff, although it's a little bit disconcerting. I must say, sitting in the doctor's surgery and going, my doctor's Googling this? I could have done this at home. Although it depends on asking the right questions. Well, everything to do with AI is all about asking the right questions, right?
Yeah, that's right. And we should definitely hold on to the belief that we need the doctor's profession and the doctor's knowledge to maneuver the answers of AI rightly. And the saving of time aspect you mentioned is quite interesting. We hope that the doctors could save a lot of time through using AI in like boring administrative kind of heavy workload tasks that are not directly connected to them treating us as patients. But we need to really wonder, well, what's going to be used with that spare time? Is it just going to be used to push more patients through the system, or will we try to shift the culture in the medical field as well, where we either give more time to doctors to reload their energy, or put like 5 extra minutes into the appointment for every patient? But we need to wonder what's going to happen with this spare time.
Look, I've got no problem at all with my doctor using Grammarly to write notes fast between appointments. That's absolutely fine. Things get a little bit more nervous, though, if doctors using AI to diagnose my condition. Although I understand, particularly in the area of skin cancer, this may not only speed up the process, but be more accurate in terms of people getting treatment early.
Yeah, exactly. One big pro of use of AI could be in the diagnostic area, in diagnostic imaging, processing, in dermatology, radiology, and those are areas where AI could be very useful for doctors to support or to make the process of diagnosing more efficient and quicker and more accurate. While at the same time, a really big worry of ethicists and doctors is that through this big focus on data collection, on monitoring the patient and looking all at the data, trying to approximate his data to the norm, comparing, that there takes sort of a reduction of the patient will take place. So the patient could easily then get reduced to his bodily physical data and not be seen as a person anymore. So we all know this situation. You walk into the doctor's office and he's already surrounded by 3 screens, asks you kind of one question, types in, you start to explain your symptoms, and you're already being shut down. And he kind of types in something else, prints you a prescription, and you leave. Yep. And so this sort of experience could intensify through AI for sure.
And already, we've had the experience of online appointments, and I mean, we're having an online conversation at the moment. The next stage, I suppose, would for there to be a virtual doctor, that I'm not talking to an actual doctor, I'm talking to an avatar. Now, that may be fine if I'm saying, you know what, I want to repeat on my prescription, that thing that I was diagnosed by an actual doctor beforehand, I need some more of those. but actually not just AI assistants, but AI doctors. That's perhaps the more scary aspect of it.
Yeah, that would definitely be a scary aspect, and we see in China already experiments on building like a sort of a virtual AI hospital where AI doctors are being trained, and definitely might be a solution for people with less resources to get access to cheaper sort of medical care.
Yeah.
But then I would ask, would you like to be treated by an AI doctor? Like, I certainly would not. I would prefer to have a human being sit in front of me, who can relate to my situation, who has a body as well, who wants to maintain their health as well. And that aspect of empathy, that's right, that's a key word here.
Yeah.
That is crucial, and empathy leads to better health outcomes. Empathy and communication skills lead to just a general much better doctor-patient relationship. And empathy is one thing that AI cannot do. So AI is good at data processing, analyzing, pattern recognition, but it is not good at empathy because it can only simulate empathy. It has no empathy. So I think in the midst of all this discussion of how can we make the medical field more efficient and saving costs, we also need to focus on the human side and not forget that empathy cannot be replicated by technology.
Although, hey, I've had some doctors with terrible bedside manner. Perhaps an AI would have better empathy than some doctors beforehand. I'm not sure all of them do a paper in medical school, but yeah, as long as they're studying the medicine. You mentioned the costs on this one, and this is a big driver. Basically all around the world, the costs of healthcare are going up, and we're wanting to increase access to healthcare. Governments are wanting to bring down their health budgets. I mean, this is one way of doing it, but not at any cost, I suppose.
Yeah, not at any cost. And as I mentioned before, we don't even know yet. So we haven't seen a big implementation of AI in the medical field, like on a big scale. So, people make a prognosis on, AI is going to save time, this and that. But actually, we don't really know yet whether that's going to come true, because the implementation of this technology will at first cost a lot of time and definitely cause a lot of frustration. So we shouldn't count on it as being a certain saver of cost, because just the big process of implementing in first and getting all the staff and all the patient used to it, that might take a big toll on costs in the beginning.
Yeah, and certainly that dystopian future where you hear somebody say the robot will see you now. I mean, we're a long way from that rather than having actual doctors. An interesting conversation, though. I know that the guys at Maxim, you guys are writing a paper on this, going to be available for people to look at, and let's have the conversation about this important policy issue. Of course, maxim.org.nz. Place to go for more of the work that you and the team are doing. Debora, thanks for your time. Thanks for joining us today.
Thank you, Andrew.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.